Hello, friends. Thank you so much for tuning into Amrina's session today. Yes, Amplify with Amrina. As all of you know, I bring promising notes at your end. And my second segment is really, really important because it is concerned with your health related issues. Yes, I'm talking about the real heroes of our time who has always been ready to help us out in our difficult times, situations, and days in respect to our health. Doctor Talk. It's not that easy to get them on board. They are fully occupied and busy with so much of stress and work and satisfying all the patients, individually handling them, keenly and observing them, their mental issues, imbalances, depression, health hazards, and a lot of things. Interesting topic today is about very fascinating, basically, because normally we don't even think about this. I have on board with me today indeed a very, very keenly observed personalities when we talk about doctors. Smile is what is all about in today's world, right? Isn't it? And you have to look good, even if you give a small smile as well. So put your hands together to welcome on my boat with me, Dr. Muhammad Abdul Saleem, known as Dr. Saleem, very famous musculofacial surgeon. Everybody must have known him by now, whom I'm talking about. He has seen a number of patients around Jeddah, but known in Riyadh, Dammam, and other cities as well in Saudi Arabia. Thank you so much for tuning in again and witness with me Dr. Saleem today. Yes, musculofacial surgeon, all the way from Jeddah. Assalamu alaikum, sir.
Walaikum assalam. Uh, how are you, Amrina?
I'm fine, thank you. I'm fine, thank you.
Alhamdulillah.
How are you doing?
First of all, Alhamdulillah, first of all, I would like to thank Almighty Allah for giving me so much blessings. And I would like to thank you for inviting me on your program. Though I'm short of time, uh, it has been a nice experience in Jeddah since last 10 years. Alhamdulillah, by the grace of Allah and by the grace of love of you all, I am here. Uh, so I think we should not waste time since it's, I want to be more informative. Let's begin the topic.
Yes, definitely. Doctor, there are few queries I would like to put in your notice is that it's just like I want to know first what is oral and maxillofacial surgery and what is oral and maxillofacial surgeon. Can you just define a little bit of it?
Okay. The name itself shows you what is oral and maxillofacial surgery. Like oral means the mouth, okay, which includes the teeth, the gums, the mucosa, the buccal mucosa, the tongue, all what are the things inside your mouth. Then maxillo is the upper and the lower jaw. The upper jaw and the lower jaw we call it as a mandible, and the upper jaw is called as maxilla. So we usually are related to the upper jaw and the lower jaw, including the temporomandibular joint. The joint, most of the patients, they complain of the joint pain. They are unable to eat, or when they eat, they have pain near the ear. So we usually deal with all this kind of stuff, including the nose, the of course the nose, the sinuses, the area below your eye. Uh, so basically, this is, I'll tell you in detail what all surgeries we do. So an oral and maxillofacial surgeon deals with all this kind of stuff. Like if you say there are many advances in it, we deal with both medically related and dental related. So we do get training in medical stuff and dental stuff, like uh, like this. So this is basically oral and maxillofacial surgeon. Usually people think that going to a dentist will solve the problem, but the dentists refer us for cases like this. It includes trauma, assault cases, injuries of the face, injuries of the mouth, cyst, tumor, impacted teeth, any kind of surgery, including cancer. Now recent advances are like reconstruction surgeries. Like we take a flap from the other part of the body and we place it in that area. So this is all we deal about.
Hmm. Okay. Doctor, again, one more query. What are common oral surgical procedures which you follow?
Common oral surgical procedures mostly we see, which everyone has to face, is impacted tooth. That is a tooth which doesn't come out in the mouth. That is called as an impacted tooth. Usually the wisdom tooths are stuck there. Like
Ah,
uh, this happens basically due to the lack of space in the mandible or maxilla. The tooth itself is not in a proper position to come out. Like it will be either mesially tilted or distally tilted. So the tendency of the tooth is that it tries to come out by itself. When it cannot come out, it creates infection over the area. That is called as pericoronitis. So we usually do surgery and we remove the tooth. It's a surgical procedure of around half an hour to 1 hour. We do. We sometimes we need to cut the bone. Sometimes we cut the tooth. The tooth which is to be removed, we have to split it into pieces, and then we remove it. This
okay.
is the most common. The second common thing is canine impactions. We say canines are impacted. Sometimes you have small swellings in the mouth, that sebaceous cyst, we call it sebaceous cyst. It usually happens due to the injury of the cheek, while sometimes when you try to eat and you accidentally bite your cheek. So it creates the blockage of minor salivary gland, which causes retention of saliva in it.
Oh,
That causes a swelling, which is painful. So we do surgeries like that. The second, this thing. Third, if you want to say the procedures which include in this is trauma, assault injuries, or accident cases. You see a mandible broken or maxilla broken, or any injury on the face, any injury on the nose, any injury like this. So what we do is that we go for radiographs. They are very recent trends now. CT scans are there, 3D CT scans are there. We use that as our guidance, and then we do a surgery. See, we cannot place plaster inside the mouth. So what we usually do is we just close the patient's mouth. That is called as intermaxillary fixation. We close the mouth and then we try to do a plating with screw and plates. We open the area up, we reduce the mandible or the maxilla, whichever it's broken, and then we do plating and put the screws in it, and then we close it. So this is how reductions of fracture is done. The third thing is uh, what we say. The other things are like if you go for cancer patients, oral cancers, we do excisions, radical neck dissection. This usually happens due to the habits of the patient, tobacco chewing, or this is more common in our countries. So what we do is that uh, use, uh, we do radical neck dissection, and then we do reconstruction of the area. That is, we take the graft from the other part of the body and then we place it in that area.
oh,
That this is called as microvascular surgery. Okay, and then basically most of the people have TMJ problem, temporomandibular joint, the joint above the. See, ours is a very complicated joint. It's the only joint in the body with two attachments. All joints in the body have a single attachment. So this is called as bicondylar, by two condyles. bicondylar synovial giglimoid type of joint. This is the name of the joint. So the name itself is so complicated. It has fluid in it, synovial fluid. Most of the people doesn't know. They say, how can a joint have a fluid? Joint has, it has fluid in it. It's called, so internal dearrangements of the joint. Some people will come like they are not able to open their mouth. So what is the reason? This is called as trismus. They cannot open their mouth. There are some people, they come who cannot close their mouth. They are not able to close their mouth. Their mouth is just open. We call it lockjaw in common terms. So we need to reduce those joints. It's like this. Whatever the procedures, then recent advances are rhinoplasty, nose correction. One more beautiful this thing I will be telling you in detail later on, like face correction surgeries. Some people have short jaw, some people have bird face, some people's faces, upper part of the face is big and the lower part of the face is small. So we do osteotomy in those cases. We break the jaw and then we move it in front or back, sideways, whatever is required, and then we correct. The most important aspect of our uh, our subject is the occlusion. Whatever we do, we try to maintain the occlusion. Occlusion is the functioning that if the functioning is not proper, the patient cannot eat. So what we try to do the most is to maintain the occlusion. Like we want to maintain how the we want to give the proper functioning to the patient. This is us, like we are the oral surgeons and proud to be one of them.
Wow,
Alhamdulillah.
wow, amazing,
Like
amazing.
it's all what we say, the blessings
Subhanallah.
from Allah subhanahu wa ta'ala
Yes.
that has given us this opportunity to help our community. Basically we try to help most of the patients. That's
Yes, mashallah, tabarakallah. The way when you were explaining, really, it's indeed a very hard job. It's not that easy because I was like, literally, I was imagining, but still, I couldn't, and I could feel that the pain you people take to take up the patients. Fine, doctor. Another question from my side is that what is wisdom tooth and what is wisdom tooth surgery? And I want you to tell me a little thing about this. It's like why like they don't erupt, and if there are any other tooth in mouth which don't erupt, and is it a myth that people say that wisdom tooth, if it's there and if it's not there? Just explain a bit, because many people they talk about wisdom tooth, so that's the reason why I want you to highlight.
see,
I
just
can
to
understand the smile on your face.
just to make people laugh, I'll tell you
Yes,
something.
please do that. We need a bit of
uh,
entertainment from doctors as
uh,
well.
why do we call it a wisdom tooth, or in Urdu we call it akhal dad?
Yes.
The main question is why.
Yes. Why?
See, the wisdom tooth erupts at the age of 18 years of age. And I personally tell my patients that your whole wisdom has come now. Not just the tooth, the wisdom is also there with you now. So
Yes.
the name itself is shows that it comes at the age of 18 years. It's third molar, like we have three molars. First molar, second molar, third molar. Okay. So why wisdom tooth does not erupt? Because it doesn't have space in it, in the jaw to erupt. This is very simple. Okay. Some patients, now it's very common, like most of the patients, they have a jaw of their mother and teeth of their father. Okay. So the
Jaw of their
teeth are
mother and the
and
teeth of.
of their father.
Oh, wow.
So
Okay.
mostly the teeth are bigger and the jaw is small.
Oh.
Okay. So when the second molar erupts at the age of 13 years, okay, behind that is wisdom tooth. It doesn't have any space to come out. Okay. The tendency of the tooth is to go mesial, in mesial direction. like it moves in the middle part of the body, like in the mesial direction. Okay, it tries to erupt, but it gets stuck under the second molar.
Okay.
If it doesn't have space, gets stuck under the second molar. It's not necessary that it has to be mesioangular impacted teeth. It can be distoangular, inverted, horizontal. It depends from case to case and person to person, usually at the formation of the tooth bud. Okay. This is the real cause of why the teeth are not erupted. Second thing is what we do for patient for this is there's no other treatment for wisdom tooth other than removing it. So we do the procedure under local anesthesia. It's 20 minutes to 1 hour procedure. We give local anesthesia, we expose the area, we remove the flap, we cut the bone around the tooth to expose the tooth. Like we have to go under till the tooth. Then we cut the tooth and remove the tooth and close it. Okay, this is the procedure for wisdom tooth extraction. Okay, is there any other tooth, your second question, any other tooth other than wisdom tooth
Yes.
which is impacted? Yes, there are. Second common impacted teeth are canines. The third common is premolars. What happens, why canines don't erupt? Like basically the issue is the retained deciduous tooth. Like the deciduous tooth doesn't come out, doesn't get evolves out, doesn't get removed at its correct age. It gets retained in the mouth. So there is no place for the canine to come out. It gets retained inside. So this is more dangerous for the tooth to stay in the bone. It can cause cyst, it can cause abscess, it can cause infection. So what we do is that nowadays we are doing here also most of the cases, like we remove the deciduous tooth, we expose the area of the canine, we expose the canine, and then we place a bracket on it. It's a small like steel kind of this thing, bracket, ortho bracket, we place it. We then we tie a ligature wire to it and we try to pull the tooth in the mouth.
Oh.
Okay, this is the work done by me, oral surgeon, and an orthodontist.
Okay.
So we try to pull it out in its place. So this is the second common. Either it may be canine or premolars, depends from case to case, person to person.
Okay. Interesting. Well, we are getting very good reviews from viewers saying that very informative interview, and many of them are saying that Dr. Saleem is most well-known doctor in Jeddah. Thank you so much, Farhan Yazdani and Hasib Ahmed. Okay, the another question, doctor, is what are the cysts of the jaws? Are they dangerous if not treated? Because many of the people, they just think, it's just a cyst and we're going to leave it. It's okay. It doesn't matter.
Okay. It all depends on the etiology of the cyst. Any cyst should not be left. It has to be removed.
Okay.
Okay. Cyst, there are many kind of cyst in the mouth. Basically, it'll take a whole day if I classify and explain you everything. So,
Yes.
and what is a cyst? You think of a balloon filled with fluid in it that is there inside the bone.
Wow,
Think
good
like that.
explanation. Okay,
Okay.
okay.
So, cyst is a pathological cavity. It's a pathological cavity containing fluid, semi-fluid, or gaseous content. Okay. How do we diagnose a cyst? Usually, the patient comes to us with pain in the area, infection, swelling. Okay. So what we confirm the diagnosis with our X-rays, CT scans, and we afterwards we do enucleation of the cyst. The lining of the cyst has to be removed. All the content has to be removed. and then we send it for biopsy. Okay, the biopsy result shows us that what kind of cyst was it. Clinically, we can tell that if it is residual cyst, any tooth which is remained before any prior horrible extraction, where the tooth has been not removed completely, there is retained deciduous tooth, then we come to know that it is deciduous. It is residual cyst. If it is odontogenic keratocyst, by the content of the fluid and all, we come to know due to our experiences. But most of the time, we confirm it, and then we to exclude the reoccurrence of the cyst. Like if we don't send it to biopsy, we are not confirmed whether what kind of cyst is it, what are its characteristics, what it can cause in future in the area. It's like that. So like odontogenic keratosis, OKC, will have daughter cyst adjacent to it.
Oh.
It's like this. So it's the process that we do, and then we remove the cyst. Sometimes the cyst is more enlarged, it is big, large, and then we need to do there are chances of fracture of bone will be there. So we do intermaxillary fixation, and we do plating, we do regeneration, we do bone grafting. We take the bone from the other part of the body, and then we place in that area. Like we take the iliac bone from the hip, from that area, and then we place in that area. So this is how we go for the cyst treatment.
Okay. There is one question from the viewer side, but we will take it at the last session when all the questions are over, okay? Or you want to go with the viewer's question now?
No, if it is related to this topic,
Yes, it is
you
related.
can.
Related. It
Okay,
is related.
okay.
Nabila Naeem, she's asking, does taking out wisdom tooth affect your eyesight?
I wear glasses for around 20 years. Does that mean my teeth are weak?
I think that has answered her question very nicely. Everyone will remove wisdom tooth, doctor.
See, it's a myth. It
Yes,
has
yes,
been coming since centuries, not even centuries. I mean to say, hundreds of years. Like
yes,
before, there was not local anesthetic agent.
yes,
Like
yes,
maybe suppose 1,000 years back, or maybe not 1,000 years is too much, maybe 200, 300 years back, there was no drug to give anesthesia.
yes, yes,
So what they used to do, I have seen some pictures, like a patient sitting on the chair, they are holding it with chains and all, and then one person is holding his mouth, another is pulling his teeth. It's like that. So the trauma which he goes through can cause mental disturbances. I think like this is the main problem with it.
yes. I think that has answered her question. The answer is superb. Now everybody is going to remove wisdom tooth after listening to Dr. Saleem, because so many of them, they actually adore you like anything. Thank you, Syed Afzaluddin. Thanks, Amrina, for such a great program. It means a lot to me, and please do tune in for other programs as well. So nice of you. Okay, Doctor, another question from my side is that what are the recent trends in tooth replacement?
Okay, recent trend in tooth replacements. I say implants, dental implants. This is the most common, and everyone is running behind it. Most of the doctors, they are organizing some 6 months hands-on course on it, or small courses on it, so that
Yes.
it's like this. So what we do here is that we place dental implant, and then we wait for 3 months, and we place the tooth on it. So dental implants are usually titanium screws. We drill in the maxilla or the mandible, we place them there, and we close it for around 3 months for it to heal, so that after 3 months the implant get fused to the bone. Then afterwards we do a second procedure, In that we place the teeth on it. Till 3 months, we give temporary dentures to the patient. Dental implants are the recent trends that is nearest to the natural tooth. Functioning is very good, and the results are also very nice, but they are quite little expensive, but it's worth getting it done. Like we evaluate the patient in these cases. We take x-rays. After x-rays, we see the width of the bone. Now cone beam CT, there is a new diagnostic technology called as cone beam CT. With that, we even come to know even the slightest bone erosions or something like that. With that, we construct a splint. We don't even need to go do a bigger surgery in that. We just put the split, drill the screws in it, and then after 3 months we place it. The whole denture, if you want, I can share some picture of it.
Yes, please, sir.
I'll try to share.
Your camera is tilted, doctor.
It's okay now?
No, it's not. It's not.
I think when I'm going to 1 minute, I'll
Share
just
maybe
share
because
this.
of this it's
Yeah,
coming.
because
Yeah,
of
it's
this,
okay.
it's coming like
It's
that.
okay. It's okay.
See, if you see this, this is the dental implants, case of dental implant. You got that?
No, no, not yet. Yes, now we can see. Yes, perfect.
Okay.
Wow.
So this is the teeth which we have placed already.
Oh my God.
I'll
Okay.
show you the. I don't want to show much of the surgical pictures because unnecessary viewers will get
Yes,
afraid,
yes,
seeing that
afraid.
someone may
Yes.
not like it. And
Yes, we actually got a lot of questions from viewers. We've got okay, Sayyid Amir, mashallah, very informative interview, excellent answering by Dr. Saleem, very satisfying. Thank you. And Munir Ahmed, mashallah, Dr. Saleem is giving a very informative interview. And thank you so much, viewers, for listening to our conversation, and especially Dr. Saleem's tips. It's simply remarkable and excellent. Asib Ahmed. Okay, I'll ask this question. Muhammad Safiullah, very informative explanation about wisdom too. Thank you so much again.
did
And
you
yes,
get
Nabila.
the second picture?
No, not yet. Not yet. We are about to. You can just slide it, and I think we can.
I think it takes time to
Yeah, it
share
takes
the
time.
pictures.
Yes, it takes time. Yes. But doctor, what kind of this thing? It looks like steel, right? So
You got this second one?
second one I didn't. The first one only we can see.
That's the teeth picture I have sent, right?
Yes.
The second one. I think it's some issues regarding saving the
It's okay.
pictures.
It's
We'll
okay.
do
No
that.
problem. Yeah, we can just continue because we're getting a lot of questions from viewers. I'll take a few questions from the viewers, and then we will be back to our the questions from my side. Okay. Okay, Sayed Afzaluddin asking, please ask Dr. Saleem what is his advice for young generation kids in order to. Hello, Doctor. Oh my God. Just a second, viewers. I think there is some connection problem with the doctor. Yeah, he's coming back. Okay, that's perfect. Yeah.
Yeah,
No.
sorry.
Yeah, it's okay. It's
By
okay. It's okay.
mistake, I.
It's okay, doctor. No problem.
It's okay.
Okay, doctor, there is a question from the viewer. He's asking, Sayed Afzaluddin is asking, please ask Dr. Saleem, what is his advice for young generation kids in order to keep their tooth healthy?
Diet. That is my first advice. I can advise the parents, not the children.
Yes, of
I don't
course.
like advising the children.
Please go ahead and say a few things about that. We really need it.
Don't give 1 real or 2 real when the children are going to school, especially mothers.
All the mothers are listening. I'm a good mother. I always give them healthy food when they go.
See,
you can hear me? You can hear me now?
Home food is the best food that will really protect your teeth.
Yes,
See,
doctor.
why caries is common in children? First of all, I will tell about the infants. When you are feeding infant after any feed with a feeder, you're supposed to clean the teeth or clean the mouth with a wet gauze, wet cloth, or at least with your finger. So there should not be any film of milk on the tooth.
Oh, really?
Yeah, that will have lactobacillus bacteria that will cause caries. This is called as rampant caries or nursing bottle caries. You can see a 3-year-old child with all teeth are black. Like,
yes, true.
It's not his fault. How can you tell that a 3-year-old child is not brushing a teeth? Like, they just parents give the feeder in the nighttime drinking. They don't follow the timing for feeding the baby. They give whenever the baby cries. They give the milk, and this is more common in our community. I tell most of the parents the same thing. It is you who are making your child in trouble. You're putting your child in trouble. Second thing is fibrous food. When the child starts eating, he should be having more of fibrous food. Those are not sticky food. Like the refined carbohydrates, especially these burgers, junk food, this is the main cause of caries. This is the main cause of tooth decay in children. So I think parents will understand this. It's a very, I have said it rashly, but that's the truth actually.
No, because you love the kids so much. That's why you're concerned about it. That's the reason why you have said it. So I think everybody has to take the critics positively, and that is the main thing for saving our children from getting into such kind of situations. Doctor, thank you so much for your answer. And another question we got from Hasim Ahmed. He's asking which toothpaste you suggest for us. For us, I mean for him, of course.
Instead of which toothpaste, you should learn how to brush your teeth.
Okay, great. Can you just explain a bit, please?
See,
That's again as interesting.
let's say all toothpaste in the market are competitive. They are priced competitively, and they work the same. Those are the basic ingredients they put in the toothpaste. But the technique of brushing is very important. I will tell you a name that is called as Bass technique. BASS. Bass.
Okay, pass.
You can search on YouTube and learn it. That's very simple and very. It helps a lot. It cleans your teeth and prevents from caries of the teeth. Children should have fluoride toothpaste uh, so that fluoride have anti-cariogenic effect. Most of the toothpaste are with fluoride nowadays. It's not an issue.
Most of them. Okay. Again, thank you so much, Doctor. I believe Hasib, Doctor has answered your question very nicely. Okay, we have got another question from Nabila Naeem. She's asking, thank you, Doctor, for your reply. Could you also let us know about burning sensation in mouth? Is it related to tobacco consumption? Please let us know.
See, burning sensation in your mouth. If you say if you see the habit, if it is tobacco, it's definitely caused by the tobacco.
Okay.
Okay. If the history of tobacco eating is there, that is by tobacco. If the patient is not in a habit of chewing tobacco, then you have to examine, you have to see whether it is lichen planus. There's a disease called as oral lesions called as lichen planus, leukoplakia, erythroplakia, abrasions in the mouth. So these all things will be causing burning sensations.
I see. Okay. Great. Another. Okay. Fahad Moinuddin wants to ask you, does smoking affect oral health?
Of course, it affects oral health.
Okay. And then Fahad Moinuddin is asking, what about chewing tobacco? Yes,
Of course,
you
of
just said
course.
it a
These
while. Yes.
are the anything which is hazardous. No, they are not stupid to write on the cigarette pack that smoking is injurious to health.
Yes, yes, of course, of course. Very well said, doctor. And Khamar Jahan is asking, my baby is 14 months old and he just got his incisors in upper and lower jaw. I would like to know at what age the whole teething process would be completed. Is it delayed in his case? Please reply.
14 months he got his anteriors.
Yes. He,
Okay. It's
incisors.
little late in scissors. It
Yeah.
depends on the hereditary also, and of course, by 2.5 years, he should be getting all the teeth. There those actually, if you say there are 10 deciduous teeth in the mouth, 5 in upper jaw and sorry, 10 in upper jaw and 10 in lower jaw. So 14 months is little late, but again, it depends on the hereditary.
Mm-hmm.
If after till 2 years, if they are not if the teeth are not erupting, we do growth hormone test and all, but I think it will come out, inshallah. It's not an
Inshallah.
issue.
Okay. And Shaila Naeem is asking, doctor, please, can you tell something to keep our gums healthy?
Brush your teeth.
Brush your teeth and keep smiling. Okay. Fahad Moinuddin is asking, thanks, doctor. Any suggestion how to quit smoking or chewing tobacco habit? I think I need to have the session of quit smoking.
Inshallah, next time.
With due respect, doctor,
See,
can you just say, can you just tell him about, I mean, he's asking a question. Any suggestion how to quit smoking or chewing tobacco habit?
how to quit smoking, it all depend on your mental health. You should
Yeah.
have a strong willpower, and you should overcome the withdrawal symptoms. There are some drugs in the market which helps you quit smoking.
Yeah.
One among them is very famous, called as Champex. Daily 1 tablet you have to take to reduce the withdrawal symptoms.
CHA, Cham.
CHEMPEX.
Okay. Sorry. CHEMPEX, Champex tablet. Okay.
So it all depends on your mental health. That's it.
Uh-huh. Okay. Doctor, my another question is, what are dental implants and what is the treatment? What is the treatment protocol for this?
I think I have said you right. Okay.
You told me about what are the recent trends in tooth replacement.
Okay.
But what are the dental
what are dental implants?
Yes.
It's the same. Like dental implants are titanium screws which are placed in the place of the roots of the teeth. We do immediate implants and delayed implants. We have two kinds of procedures. Immediate implants are when we remove the decayed tooth immediately in that area, in that root place, we place the implant and keep it again for 3 months. And after 3 months, we place the crowns on it. The delayed type of implants are first we remove the tooth, we allow it to heal, we allow the new bone to form. Then after 3 months, we drill in that area and we place the implant again. And then after 3 months, again we place the tooth. That is nearest to the natural tooth. Even I have placed here like whole jaw, complete jaw we have replaced. Many patients are there to whom we have replaced. The picture, I think that is the whole jaw replacement
Yes.
picture.
Okay. Doctor, we got one question again from the viewer. We will take this and then we will come back to our question session. Sayyid Jamil Ahmad Razvi is asking, if a tooth is half broken in diagonal shape, is there any treatment? If there is a treatment, so at what age is required?
Tooth broken in diagonal shape. It again depends on how much it is broken.
Yes.
Okay. If it is in enamel, see, a tooth has three parts: enamel, dentine, and pulp. So we classify it as level 1, level 2, level 3 fractures, like these tooth fractures. If it is in level 1 or in enamel, we just cement it. That's it. If dentine is exposed, if it is in dentine or if it is in pulp, then we do root canal of that tooth and then we place a crown on it.
Okay. And another question we got from Munir Ahmed. He is saying that which tablet is common and best for any kind of pain for tooth pain?
Any kind of painkiller is common.
Okay, fine. Any kind of painkiller is common. That's indeed true. You're right. As long as the pain is
Subsided.
Yes. We've got another question from Syed Afzaluddin. He's asking, Doctor, which toothpaste you suggest for adults? Few people have bleeding. Oh my God, where is the question? Okay.
Bleeding
Few
gums,
people
I think.
have bleeding issues while doing brush.
Bleeding issues means gum diseases. First of all, you should get your teeth cleaned by a dentist, general dentist, not with me. You should get your teeth cleaned with by a dentist. Then use Parodontax gum care toothpaste.
How is Hemoform F?
Hemoform F is good. It's not for gums, it's for teeth. It has
Sensitive teeth.
fluoride, it's anti. Yeah.
Yes. How is Oryx? You know why I'm asking? Because these two toothpastes I used, so that's why I'm asking you. Oryx, how is Oryx, doctor?
See, all are same. I think this it doesn't make any like. I'm not into much of the toothpaste stuff like this, but for me, I say all are same. Unless if you have sensitive teeth, you have to go for sensitive kind of tooth.
Yes, yes,
Sensitive
true.
and
True.
gum care toothpaste for the gum.
Yes, true. I hope doctor has answered all the questions of the viewers. Thank you so much. We'll be back to our question session. Can we replace all the teeth by dental implants?
Yes, I said you right.
Okay.
Whole mouth
Yes.
can be replaced. Whole
Okay,
mouth.
great. And how do
Now we
you
have recently if there is no bone. See,
Mm-hmm.
it's not necessary that if long-term denture wearers, they have very low sinuses.
Uh-huh.
Okay.
Okay.
The sinus cavities are very low. For them, what we do is that we do bone grafting and then we place implants.
Oh, wow.
Okay. Now recent trends are pterygoid implants, even pterygoid implants, long implants that go all the way to skull and pterygoid bone.
Oh.
And then we place tooth on it.
Subhanallah, amazing. Mashallah, tabarakallah. Okay, doctor, how do you select the cases? Depending how is the selection of the cases like, and how do you manage the injuries on face, and then you can just say a bit of this and then you can
See,
say.
how do you select cases for what? For implant patients?
Yes, for implant patients.
Okay. See, patient comes to us. He tells, I want to get my teeth replaced. We give him option. You have this can be done. Okay. Then we advise the patient to take a radiograph, primary assessment. We do it. We see the density and the condition of the bone. Then we advise him. We even do cone beam CT, CBCT, and that will also reveal us the implants mainly depend on the health of the bone, whether it can be done or not. If the bone is very thin and very less, then those are not the ideal case for implants, and we tell that we are sorry, we cannot put implant on you. And if it is minor discrepancies there, little bone damage is there, then we do bone grafting and then we place the implant. This is how we select the case.
Okay. And another question was, how do you manage injuries on face? Because I've seen some of your pictures and I can share it with the viewers because it was really heart touching. That's the reason why this question came in my mind.
See, uh, facial injuries are very common, like any kind of assault, any kind of fights, any kind of accidents can definitely lead to fracture of your bones. At least they will cause abrasions or injury of the lower lip, injury of the cheek, deep lacerations in the cheek. If we examine the patient, we take primary radiographs, and then we see if there is any fracture or anything else is there. If it is not fracture, we just suture it up, we close the wound, and then we send the patient. If fractures are there, then again we have to do intermaxillary fixation of the upper and the lower jaw, so that movement of the jaw should not be there, because that will again cause pain to the patient. And again, uh, uh, again, if we reduce also, it will again it will get dislocated. So then we do intermaxillary fixation, and the most important thing is that occlusion, functioning of the jaw. So for functioning of the jaw, we reduce it and we close the jaws in the biting position, and then in that position we do the fixation by screws and plates. There are many kind of screws now. Recent trends are biodegradable plates are also coming, like the plate, it vanishes by itself, it gets degraded by time. It's like that. So
It's
then
advanced
we will
technology
close
now,
advanced
right? Yes.
technology in it.
Great, great, great.
I mean,
Doctor,
even in
yes.
advanced technology, if you say the CT scans are there, MRIs are there, we do all those stuff to see the correct uh, uh, area of the fracture, to examine the correct area of the fracture, to reduce if it is having multiple fractures are there or commutated fracture. Then we do plating, that's it. And we have even do those are the small plates. We even have a mesh, we place the mesh, a whole mesh on the bone, and then we screw it so that the bone get intact on it.
Okay, interesting. Doctor, we have got a lot of queries from the viewers. Ghazala Sohail Naeem, she's asking, Doctor, can you please give information about flap surgery?
Okay, flap surgery is basically a surgery of gums. I think I have okay. Basically, I have sent a picture to you. I think I cannot share it again. It will get
No,
disturbed.
it's okay. Yes, yes.
Okay. So flap surgery is the surgery of the gums. What we do here is that it usually happens due to necrotic tissue in the gum. There are chronic gum diseases leads to gingivitis. So for these cases, we just open the gums, we clean it all from inside, and then we clean the necrotic tissue. If required, we place bone graft, because with the gum diseases, the bone also gets resorbed around the tooth. You're getting my point? The bone is resorbed around the tooth. So we replace it with bone graft. There's hydroxyapatite powder will be there. It's like that. Small particles will be there. So we place that and then we close it. So after 1 week, you will definitely see the results. The swelling of the gums is reduced with it.
Oh, amazing! Yes, you have shared that picture with me. It's very horrifying, but we need to witness that. It's just like it's a pit basically inside the
Yeah,
gum.
inside
It's
the gum.
actually a pit, and you're filling it up and you're covering it up. Yes, amazing. Mashallah, tabarakallah. Doctor, I believe the doctor has answered your question, Ghazala. We got, okay, thank you so much, Sayyid Ali. He's saying, Mashallah, very vast knowledge and very well satisfied answers to each and every question. Jazakallah khair. Thank you so much again. Hasib Ahmad, he has a question. He's asking, implantation can be done for older people like above 50, 60 years old? Yes or no?
The last case of my implant was an 80-year-old man who used to come from Medina. Sorry, Jizan.
Wow, mashallah,
They used to
tabarakallah.
take a hotel here and stay here. They got it, get it done, and they went.
Subhanallah. Yes. Thank you so much, Doctor. Atta Shaiji, does scaling and polishing affect the life? Atta Shaji is asking, does scaling and polishing affect the life and health of the teeth in the long run?
Uh, if you want your teeth to be healthy, you should get scaling done every 6 months. It's a process. The book says that every 6 months scaling should be done. So it
Okay.
doesn't affect anything if it is properly done. And just keep in mind that polishing should be done after scaling. That is compulsory. Most of the dentists, they don't do polishing. They don't polish. So after
Okay.
scaling, polishing is must.
Okay. Thank you so much, Doctor. Burhan Gori has a no. Okay, Burhan Gori is saying, "Mashallah, very nice and informative talks. Thank you so much again." Muhammad Shafiullah is asking, Doctor, can you please advise about oral hygiene in kids and bad mouth odor?
Bad mouth odor in kids.
Yes.
Uh, I think that in kids, it should be, we have to see the bowel habits of the child also. What he is eating and what are his bowel habits, first thing. Second thing is brushing properly and all. It should not have any issues.
Okay. Okay. Uh-huh. Thank you, Doctor. Syed Amir has a question again. He's asking, Dear Dr. Saleem, my father is 65 years old. Can we replace all the tooth for him while he is having some tooth remaining?
Yes, we can, of course.
Okay. Okay. Khalil Ahmed has a question again. Is okay to drink water immediately after eating sweets or chocolates, or this deteriorates the teeth? Yes or no?
No, you can have water immediately. What's wrong in having water?
Okay. Now, normally, it is said that when you take ice cream, you should not drink water. Is it true,
Uh,
doctor, or again, it's a myth?
Again, is a.
Like
I
a
think it's
wisdom
a myth.
tooth.
I never read all this stuff in my.
Yes. Okay. Fine. Doctor, my questions are little more. I'm sorry for that. How to? Okay. Okay. How do you manage a fracture of facial bones?
I said you right.
No,
Uh,
you
we do
you told me about
we do
the.
intermaxillary fixation first, and then we do
Okay,
screws and
that
plating.
is
This
okay.
is
Okay.
the ideal procedure for management of
Okay.
fractures.
Fine. Okay. Okay, what do you do when a complete tooth falls due to injury to children or adults? In children and in adults,
Okay, a
or in
complete tooth
adults?
fallen due to any kind of assault or fall or anything like that. It is called as Evel's tooth.
Okay,
Evel's tooth.
okay,
The first thing everyone should keep in mind that the same tooth can be placed back.
uh-huh,
Okay, but it has certain conditions.
okay,
The if you first of all, if the tooth is Evel's, first thing you should do is to put it in milk or in the patient's saliva and bring it to dentist. Then they can place it in the same area, say same socket, in the same socket, and then we do figure of eight wiring around the tooth so that it fixes inside for 3 months. Okay,
okay, okay,
if you cannot find any milk or anything, just it pains the patient little, but you just take the tooth and put it in the same place by yourself, and then come to us. We'll just do figure of eight wiring to the patient. We'll try to fix the tooth by wiring. Okay, you can just push the tooth inside the socket. The socket, it's a place, it's a socket, it's a space. Most of the people are not that brave heart to put the
hmm.
tooth in the socket. Just try to put
Yes.
it up, push it up in the socket.
Oh, yes, true, true. Okay, doctor, that's very interesting the way you said just push it up and try to fix it up. Kamran Mahmood, Muhammad Atiq has joined. He's saying Dr. Saab, and I think he's conveying you salam. Kamran Mahmood is saying, what is more beneficial, screw teeth or bridge for teeth?
Pardon?
The screw for teeth or bridge for teeth? What is more
Screw for
beneficial?
teeth is again the implant. Of course, the
Mhm.
implant is the best, and it is the nearest a person can have to the natural tooth. But
Okay.
it's quite expensive, so most of the patients they prefer to get bridge done.
Okay. 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 And Burhan Gauri has another question. What is the solution for bad smell find while talking with others? Yeah, this is a very common factor which I
No,
also.
I just want to clear it out. Bad breath while talking to others means if you have bad breaths or others have bad breath.
Um, I think when he's talking, he must be feeling for. You
Okay.
can say both. It's a nice way you have
I
actually catched the question. So,
uh, uh,
like you didn't allow him to give a
I
checka.
don't have
You know.
any answer for the other person. But if you have bad breath, the first thing, if you're
Others,
not
he's asking
chronic,
others.
others have bad breath, I can't answer this. This is
Okay, then say.
just give him one chewing gum, just give him one gum or something like that. That's the best thing you can do.
Okay, doctor, if it's for us, say like, I mean,
It's for us. Okay.
yes.
See, if you don't, bad breath usually happens if from the mouth. It's happened due to periodontal disease, like
Okay,
it's due to the gum disease. Okay,
okay,
you should understand this, and you should get it treated. There are mouthwashes that reduce the periodontal inflammation and that reduces the bad breath. And the second main cause of the this bad breath is what we say dryness of mouth. So you should keep your mouth hydrated. That's it.
and how to keep the mouth hydrated by
You can just get chewing gum or something like that. Drink a lot of water. Take gums. It's like this.
Okay, okay. Thank you, doctor. Doctor, we've got one question from Zainab Zikrash. Is asking, doctor, please give some advice about oral care for diabetic patients.
See, diabetic patients usually have weak gums. Weak
Yes.
gums. Uh, these are called as oral manifestations of diabetes mellitus. So their gums are weak. Swelling in the gums will be there. So if they maintain their sugar levels properly, automatically all these problems will go off. The
Yes.
second thing is brushing properly and all this. All these things are periodontal diseases. Like nothing will happen to the tooth in diabetes. It's the gum. The gums get swollen. The gums get inflamed. Then what will happen? Then there will be bone loss. If the bone loss is there, then the tooth will become loose. Suppose if you say, if I explain you like this, if this is the tooth and 2/3 of the tooth is attached, is inside the bone, and what you see outside is only 1/3.
Yes.
If there is bone loss, like if the bone is going down and if it's holding the 1/3 part of the tooth, then automatically it's understood that there is the reinforcement is less, so the
Yes.
tooth
Yes.
is going to move.
Yes.
So sugar levels has to be maintained. That's very important,
Yes.
and which will lead to periodontal diseases. Indirectly,
Yes.
it is leading to periodontal diseases, which is causing tooth loss.
Yes. Yes. True. True. Thank you, doctor. Doctor, we have got another question from Amritan Show. He's asking, ask the doctor for a question. What to do if the players get hurt in the nose and start having it? What bleeding? You mean to say? Yes, maybe he's talking about bleeding. Yes, he's a kickboxer actually, national
Okay.
international champion. Yeah, he's asking if he gets hurt while playing in his nose and if it start bleeding, then what? I don't think so. This.
See, no, it's
Yeah.
very
Okay.
simple.
Okay.
See, there is a area in the nose called as Little's area. It's called as Little's area. So if any irritation or any touch to that area, the nose starts bleeding. It's common. You might have heard that this is called as epistaxis.
Yes. Yes. Yes.
Uh,
Yes.
you might have heard that when you go out in sun and someone starts bleeding,
Yes. Yes.
yeah, from the nose. So this is irritation to the littles area, which causes bleeding. The only thing is that you have to put a nose pack, just some cotton or something inside the nose tightly, and it will stop. That's
Okay.
unless the bone is fractured. If
Okay.
he gets very hard kick, then the bone is going to fracture. Then he'll come to a maxillofacial surgeon
Oh.
to reduce the fracture.
Yes, yes, true, doctor, true. Thank you so much, doctor. Muhammad Atir is asking, one of my friend's daughter is completely uh, endotolious by birth. I think I'm pronouncing it.
Edentulous.
Yes,
I think
edentulous. Okay. By birth, what is the treatment protocol?
all children are edentulous, na? When they are born. What is her age?
He hasn't mentioned that. He hasn't mentioned that. And what is the treatment protocol? Is asking. I think he's going to reply back again. Fahad Moinuddin is asking. Thanks for the. Okay, no. Sayyid Jamil Ahmad Rizvi is asking. Sometimes kids drink milk with sugar added or different flavors milk. After all, is it also necessary to brush teeth?
Of course.
Yes. I mean anything which.
Anything, yeah. Before sleeping, all children has to. It's mandatory. Make it mandatory. Make it a habit before going to
Uh-huh.
bed. See, we say that brushing is morning is only for the bad breath, but brushing in night is for the protection of your teeth.
Yes.
Anything before going to bed, they have to brush their teeth. That's what I said, to maintain timing for feeding babies. After every feed, you should just wipe it with a wet cloth with your finger, or just give them some water so that the film of the milk has to go from the teeth.
Yes. Thank you so much, doctor. Very, very nicely you're answering all the questions. I mean, in fact, they all are enjoying. I can say that. Muhammad Atiq is saying, okay, the question to his another thing he's saying, she is 12 years old, still she doesn't have any teeth.
See, for this you have to take an X-ray. Uh, I think what is her mental condition? Like what I say is that it can be a syndrome. It's not just the teeth. See, if she is not having teeth at the age of 12 years, means it's a matter of concern. She may having some other problems also, other issues also. He has to get his
Oh,
examined, and we cannot say it on the talk like this. We have to
yes,
see the patient, study the case. Like,
yes, yes. Okay, thank you, doctor. Munir Ahmed has a question. He's asking, does regular eating of meat affect gums or teeth?
no.
No, it doesn't. Okay. We have got another question. Wow, we have got another. Um, okay, Devil Slayer, I don't know anyhow. The viewer joined. I have a tooth coming behind the one which already exists, and the milk tooth is still solid and not loose yet. What needs to be done?
You have to remove the milk tooth. Deciduous tooth has to be removed. Space will be created, and that tooth will come out.
Sufficient will be there, no
Sufficient.
space. Okay, thank you, doctor. Okay, Samia Wes is asking, is gum recession reversible by any chance?
No, gum recession is not reversible. What, it's irreversible disease, and once gone is gone. But we try to put it back by taking palatal graft or taking tissue from the other part of the other area, and then we do bone grafting, and then we place the graft so that it looks naturally bone graft, and then again the tissue.
Okay.
Uh, the results are not good. So I would advise what is remaining, you try to maintain. That's it.
Okay, doctor, this is related to the issue right now. What do you think about smile correction and what is gummy smile? Can you just highlight a bit
See,
because
some people will have gums covered, instead of one third of the tooth, it will be covered one fourth of the tooth.
oh,
Okay, the more gummy area, and the tooth looks very small,
very
small, tiny.
mm-hmm.
So it doesn't look. Again, we do gingivectomy. We cut the gum, we remove the gum, and then we remove the extra bone from the area, and we suture it so that most of the tooth is exposed and it looks good. Okay, this is how it is done. Secondly, smile correction, because of smile correction can be done by many ways. There is what we say ortho treatment. We do orthodontic treatment. If there is any tooth discrepancies, tooth is not in right position, we change the position of the tooth. If they are forwardly inclined, we push it back. If they are rotated, we try to bring it back in its position. It's a long-term procedure, 1.5 to 2 years. We place brackets,
Oh, really?
okay, and wires, and then slowly we have to rotate the tooth in its right position. The movement of the tooth takes place by bone resorption on one side and bone formation on the other side. Okay, it's like this. So again, this is for the malocclusion of the tooth. If there are caries or spaces are there, we put crowns on it. Veneers are there, laminaires are there. Now they are selling Hollywood Smile,
Yes,
Bollywood
Hollywood Smile. I was
Smile.
about to
I don't
ask you that.
know
I like that
what
a
it
lot.
is. Uh, the dentists have become like businessmen. They are like,
Yes, yes, doctor. Yes.
actually it should not be like that. They should not do like that. But I feel very sorry and very pity for them. Like this is not, you are going to treat patients here. You're not just coming here to for publicity and all that. The trends are changing, the things are changing.
Yes, yes,
This
true,
is what
doctor.
they are doing. They just for veneers, they give advertisement as Hollywood Smile, but
Yes.
nowhere in the medical books you will see something like Hollywood Smile.
Very true, doctor.
So
Very true. This point you have said it because I was about to ask this question. This was my main concern of Hollywood Smile. Many of them are going for this, and it's not there in medical books. That is so honest reply from your side, and let people realize that every doctor is not. I can say. What should I say? I don't have word for this, but they always think, in a business-minded way, doctors they deal Hollywood Smile because they want to they think there's more
yeah,
money in that. And
what happened in this situation is that even patient, they doubt on doctors.
yes, yes, doctor.
It's not the right ethical way of practice, I
Yes,
would
doctor.
say.
Yes, true, true, doctor. Very true, doctor. Thank you. Dr. Muhammad Atik, the same person is asking, I don't understand how can you ask a mental condition of a 12-year-old child of edentulous patient, is there any relation with her mental condition towards her edentulous condition? He's asking this.
No, that's what I want to answer him, that we have to examine it. Like it can be a syndrome. It can be a syndrome. Like tell like Mr. Atik, it can be a syndrome. Like this is not just syndrome. Is like 2 3 problems together in one patient. We have to take an X-ray. We have to know the reason. 12 years is too much for
Yes,
a
yes.
child for not erupting a teeth.
Because doctor, sorry, can I ask you something? I'm just
Yes.
wanted to interrupt you for a second. My son is in 11-year-old now, just turned on May 25th, and he started losing teeth because naturally the milk teeth will go and the new teeth will come. So that means 12 years old is quite a long period for teeth not coming, right? Don't-
No. See, if you say like, if I say that first teeth which goes in the mouth is at the age of 6 to 7 years, okay, and the last teeth, the second molar, comes at the age of 13 years. 13 years
Oh,
is the time for the second molar to come. 11 years to 12 years, your premolars will come. That means
okay,
your deciduous first molars will go at the time of 11 to 12 years, and premolars will erupt at the age of 11 to 12 years.
okay,
And 13 years behind the first tooth, that permanent tooth comes behind the deciduous second molar.
okay.
Okay, that is your first molar. We call it 6-year-old tooth. It comes at the age of 6 years. And behind that, at the age of 13 years, the second molar is going to come.
Okay. Thank you, doctor. I believe that has answered Mr. Atik's question again. Fahad Moinuddin, thanks, Amrina Khasr, for this session. Dr. Saleem, polite answer to all the questions. It was very informative. We need more sessions in future so that we can understand dental health more nicely. Yes, Mr. Fahad, definitely every Friday we will be having doctor talk and different doctors will be on board, and you can definitely witness so many medical health issues and so much you will know about medical technology. Okay, Devil is asking one question, doctor, and another viewer. Jaw locks, what causes them? Jaw locks.
Jaw lock, lockjaw.
Yes, lockjaw. I don't know. I
Okay.
guess.
See, if you examine, I said TMJ, temporomandibular joint, is a very complex kind of joint. It consists of glenoid fossa. Glenoid fossa is a part of the skull, okay, behind your ear. With that, it is connected to the articular eminence. So usually, this thing happens to people who talk more, who shout more, who open the mouth extra, like above their capacity to open it. So what happens? The mandible, it comes forward. It comes forward to the articular eminence, and it gets stuck. Articular eminence, if you see, it's like this. If you see an S shape, it's like an S shape, and the behind a sleeping S. Suppose if a sleeping S, and behind uh, the posterior behind part of the S, your jaw is to be there, and it's like this. If you say like this is the articular eminence, and this is your lower jaw. It rotates like this. It's rotatory movement. Like movement is
Okay.
rotatory.
Okay.
It rotates and then it comes forward like this. If you see like this, it comes forward. So articular eminence is here. It's a tuberosity. So it comes and comes behind the in front of the articular eminence, and it cannot go back now. So what we do is that we just apply pressure, forceful pressure, a lot of pressure on the mandible, and we push it back by force. Then it goes back.
Oh, subhanallah. Thank you so much, doctor. Um, Okay, we've got one question from Nabiha Kazi. She's asking how to improve the oral health of an elderly diabetic person with bad oral conditions, with already deteriorated conditions like clipped teeth and discoloration.
See, for this, you have to go to a dentist and get it examined first.
Yes.
Like, what are the conditions? If it is caries, then root canal is done, and then we do fillings, crowns, bridges, whatever it is. We do scalings and first maintain the oral hygiene, control your blood sugar levels.
Yes.
This is a
It's
long process.
important. Yes. Okay, Najim Ahmed has, thank you, doctor. Najim Ahmed has he has a question. My cousin is of just 20 years old and she lost her teeth slowly one by one. What's the reason? Her all other reports are normal. She concerned many doctor, but there is no other problem.
All her teeth, one by one, at the age of 20 years, this gives sign of juvenile periodontitis, early age periodontitis. Uh, like it's a disease which comes at the age of 15 to 16 years with severe bone loss.
Really?
Yes.
Oh,
And if bone loss is there, then slowly she will lose one by one.
oh,
So for
okay.
them, she'll have no choice than to wear dentures or do implants done.
Mm-hmm. Okay. Wish her good health, inshallah, Ya Rab. Thank you so much, doctor. Another question from Syed Jamil Ahmad Rizvi. He's asking the bad breath in mouth, is it the reason of stomach disturbance or the food particles stick between behind teeth or on gums?
Both the reasons are right.
Both the reasons are right. Thank you,
If it is
doctor.
due to stomach issues, you'll have to study your bowel habits, eating habits. And then secondly, if it is due to your sticky food or due to food particles stuck in your gums, that means it should not stuck ideally. That means you will have you are having periodontal problems. So that has to be cleaned, and then periodontal health should be maintained.
You've got a very nice compliment from Muhammad Atiq, because I wanted this to be written by someone, and it's going to be there in my session all the time. Muhammad Atiq is saying, nice to hear that you're not a commercial doctor. I want to know, can you give free service to any needy person, because I have so many relatives who are poor, doesn't have money to get the dental treatment.
Of course, I do here. No, no, it's not an issue. Usually, we do here by seeing the patient. If they are really poor, we do help them. We do help. We are here to help people.
Jazakallah khair, doctor. Thank you so much. Okay, doctor, my question, this is really, I think you will like it. I don't know how much. A lot of people think about Botox and facial fillers. Do you have anything to say about this?
These Botox fillers are again anti-aging procedures. We say that there was what we say, everyone has to pass through aging, but some people, they always want to be young. So Botox is usually long-term anesthetic agent, bupivacaine we call it, and then it's given, injections are given intradermal, where all the facial folds are there, or facial around the eyes and on the cheek. It's given intradermal so that the skin stretches and aging wrinkles are not seen. This is Botox. If the severity is more, then fillers are given. These are plasma proteins and all that is injected in that area so that it gets stays in that area. It's just anti-aging process. People, they like to stay young.
No, even the youngsters are doing.
So if the youngsters are doing, it's like they are afraid of getting old. Huh?
Exactly. But I think it all depends on how you think life, it's all about age is just a number. I seriously feel that as long as you're happy, you're content, and you
Of
you make
course,
others happy and
your heart should be young. I'll
pure.
say that.
Yes, your heart should be young and pure. Doctor, before that, very interesting, we've got Dr. Abdul Muqtadar from Hyderabad. He's saying you hello. He's saying say hi to Dr. Saleem from my side. And thank you so much, Dr. Abdul Muqtadar, for joining. Farhan Yazdani, sorry, he's asking, do flossing create gaps?
No, flossing doesn't create gaps. It cleans your interdental area of the teeth. It's a thin floss. It's a very thin thread which goes in the interdental area and clean your teeth. That much tooth movement are considered as natural tooth movements. The tooth has that much movement by itself.
Okay, doctor. The second question, Nabiha asking, how often should we floss?
Daily you should floss before sleeping.
Okay.
Brushing and flossing has to be done.
Okay. Another question from Dr. Jamil Ahmad Rizvi. Dr. Saleem, we are very thankful and okay, sorry, it's not a question. He's saying we are very thankful and appreciate your kind advice and support to get the lot of information and clear misunderstood questions in person mind. Okay, thank you so much. And Hasib is asking, does the mandibular incisive nerve atrophy after tooth extractions?
Mandibular incisive.
Yes.
Mandibular has mandibular nerve
Okay,
or inferior alar nerve.
he wrote mandibular incisive nerve atrophy.
After tooth extraction.
Yes.
Atrophy can happen in nerves usually after extraction. Again, this comes to known complications of tooth removal.
Okay.
And you can expect, see, any surgical procedure has both advantages and disadvantages.
Okay.
There some some patients, they get angry on doctors, they blame on doctors, they say bad about doctors, but believe me, trust me, no doctor wants to do harm to you. It's your luck which happens. Like paresthesia can happen, numbness can happen after removing a teeth. So no doctor will try to do it by himself. So it's like again, it depends from person to person and case to case. These are called as known complications. This can happen after removing the tooth. You try your best to protect it,
Yes.
to prevent the complication. That's it, I can say.
Yes, thank you, doctor. Thank you so much. Dr. Azmat Yar Khan is saying regards to you and good work. I think you must be knowing, he's saying regards to you, Dr. Azmat Yar Khan. My regards to Dr. Saleem. Fair enough.
Regards to him also.
Yes, thank you, doctor. I think that's going to be all for today, because
Thank you.
it
It
was
has been 2 hours.
yes, it has been 2 hours. I just saw the time, and we went on a flow like anything. Honestly telling, I am very lucky because I've got so many viewers on board. I wanted this live chat to happen more than me asking you a question. I want the viewers to ask their doubts and clear it out, and in fact, very nicely and gently and so clearly you have answered all the questions. Okay, thank you so much. Yeah, thank you so much again. Mohammed Atiq is saying, I really appreciate your words on helping the needy full patients, but one thing I would like to tell doctor, helping the poor patient should not be in the words alone, it should be in deeds as well. Yes, of course, as we all are doing that, and definitely sure we will be continuing with good work as such. uh, um, Hasib Ahmed is asking which question he likes the most. This is very nice, actually. We need this from one of the viewers. Can you just say which question you like the most?
All were good.
All were
Tell him
good.
his questions were great.
Okay. Hasib, doctor is saying your questions were great. And Khalil Ahmed is saying thanks you. Oh, thank you, sister. And doctor, thank you, Dr. Amrina. Thank you so much, Mr. Khalil Ahmed, for joining in my session. It's really pleasing when I see so many viewers are liking what I'm doing. And okay, that's the last question I'm going to take, because now, doctor, I took his 2 hours.
Oh,
That's
really?
a lot.
I'm exhausted now.
Yes, last question, doctor. Sorry. Assalamu alaikum. Getting many tooth cavities at the age of early 30s. Please suggest something to overcome the problem. Ashraf Khan is saying.
See, tooth caries is irreversible process. Once it comes, it will not go by itself. You have to get it treated. You have to do fillings done, do root canal done, and place caps on it. This is what I say. If you do it, if it is in the initial stages, it's better to get it done rather than expending more money on root canals and crowns.
Okay. Okay.
So if you have multiple caries, better get it filled before it goes to the pulp. If it goes to the pulp, you have to do root canal.
Okay. Okay. Thank you. Thank you so much. Well, thank you, viewers, for getting on board on Amrina's session. And every Friday, don't forget Doctor Talk with another doctors on board with me. I'm really honored and privileged for Dr. Saleem to give time, so much of time in my session. It means a lot to me. And he's, in fact, adorable creature, an adorable human being, is loved by so many people in Jeddah, as I told you, not even in Jeddah, Riyadh, everywhere. He's a known figure, very simple, very honest, and very humble person. And it is really difficult to take out so much time for an online session as well. So from the bottom of my heart, thank you so much, doctor. आपका बहुत बहुत शुक्रिया. जजाकल्ला खैर, और इसी
You're
तरह आप
welcome. Inshallah.
हंसते रहिए, because your smile means a lot to us. Now everybody is going to remove the wisdom tooth after listening to Dr. Saleem. So no eyesight, no problems of anything, and feel free. Doctor, before leaving, कुछ message देना चाह रहे तो please you can just share.
The message what I can give is that people staying in Saudi Arabia and the people who are staying in India, it's being a good human is very important. Money and fame comes by time, and what I say is that you be good, everything will follow you. This is the only thing. Be helpful, be kind, and maintain your dental health.
And do visit Dr. Saleem for
Inshallah, do
Hollywood
visit,
Smile
do
and
visit.
enamels
Yeah,
as well. Definitely. And
inshallah.
viewers, if you think I'm doing a good job and my work is really effective and efficient for all of you over there, please do subscribe to my channel. I haven't said this anytime, but if you think it is necessary, do log in and do tune into the sessions of mine and do subscribe. Every Friday, Doctor Talk, don't forget, and stay home, stay safe, and stay blessed. And thank you so much again for tuning into Amplify with Amrina. Yes. Assalamu
Thank you.
alaikum, doctor. Assalamu alaikum. Thank
Walaikum
you so much.
assalam. Thank you so much.
Thank you, doctor.